refinancing, or mortgage questions.
Treating spinal pain has come a long way, and now there's more advanced approaches that are minimally invasive and fit each patient's need. Dr. Michael Rimlawi with the Minimally Invasive Spine Institute of Dallas joins me, and that makes me very happy because, let's face it, who really likes to go into surgery, right?
I don't think too many people do.
Not many people, so we can do it as small as we can. That's always the way to go. Let's start with the difference between decompression and fusion surgery when it comes to spine surgery.
Sure. You know, most people that fail conservative treatment for their back pain and need spine surgery, it's broken up into two groups, usually decompression or discectomy, laminectomy surgery versus a fusion surgery. And if a patient has a pinched nerve, which usually causes back pain, leg pain, or a bone spur is hitting a nerve, it's a decompression surgery. We go in there and just decompress whatever's hitting the nerve. But if the patient has a little more than that, let's say their disc is completely collapsed, degenerated, and a pinched nerve on top of it, or if they have a broken spine or a medical condition called a spondylolisthesis, which is a slipping of the bone, then we got to stabilize it or fuse it. Then we do a fusion surgery for those type of patients.
Okay, well, I know you've been on the show before, and that you also perform minimally invasive decompression surgeries, but now there's an option for those who might even need a fusion that is also minimally invasive.
Correct. I do feel, obviously, I'm a big proponent for minimally invasive spine surgery. I used to do open back surgery, now I do minimally invasive, and it's just so much better for patients. So, yes, there are most patients in the United States that need a fusion surgery, they wind up getting a 360 spine surgery. Which means going through your front and your back.
Oh.
Well, I prefer for my patients a gentler surgery called a minimally invasive T-lift surgery. So for open 360 fusion surgery, this is what doctors in the United States actually use once they cut through the muscles and open up the muscles to do the work down here. Compared to, this is what I use for a minimally invasive T-lift surgery.
What a difference.
We go in between the surgeries. This is the retractor they use to hold the organs out of the way if they go through your belly. We don't need to do that for minimally invasive T-lift because we're not going through the belly. We're doing it all from the back. This is what they use to really take the muscle off and the bones off to get down to the spine, do the work. This is what I use to take the disc out. So obviously this is so much easier on the patients and than this stuff.
Let's talk about some of these advantages to the T-lift as opposed to the Fusion 360 as well.
When we do the 360 surgery, you can't do it minimally invasive. So people can't go home the same day. They're usually stuck in the hospital for 3, 4, 5 days. With a minimally invasive T-lift, we do it, same surgery, same stabilization, but they go home the same day. This makes a huge difference on how quick they recover and how much less pain they have and less scar tissue than the 360.
There are certain conditions that we are required to have the T-lift surgery.
Really, any condition that requires a fusion.
Okay.
You can do a minimally invasive T-lift. So those conditions can be a failed decompression surgery that didn't work. Or it can be a stability problem where the patient has an unstable bone, where the medical term for it is spondylolisthesis or ankylolisthesis, but really what it is one bone is slipping over the other bone because the joint's bad.
Some symptoms that will be relieved after this T-lift.
It gets rid of their pain, hopefully. It gets rid of their leg pain if they have leg pain or numbness or tingling. So it's basically to increase their function. They can get back playing with their kids sooner, driving sooner, and get back to work sooner.
All right, Dr. Rimlawi, thank you so much. What a visual. This really kind of hits home. If you are feeling any of those symptoms, any of these conditions, you definitely need to give Doctor a call. You can call the Minimally Invasive Spine Institute at 972-884-4400 or log on to mine. It's actually mispinerelief.com for more information. They're also located on North Central Expressway right here in Dallas.